Kwashwaringa abarwire bitu imibaze ya sirimu yo neza kugumaho with support from America or not, that one iyo neza kugumaho. Abakozi ababiri affected n'abere batungo umushara abo tukatungire conclusive answer tiyo mu nchiko tiyo muteka kongatrisa abarwire imbazi yo bagwana batunge imbazi abashaho ababire mbakozesebwa tiyo mu discussions tikabire concluded. Ekindi ihangarta hiriwe Ebola kino burure Ebola bw'ekiri Kampala na handi kuni tubuka shikireye konkana manyo burwe basa kusanzara numurebe basi kacinana nza Kampala ziza nakinaki so mwirindo burwiro bwokando kubwerinda na hygiene nabo mu ngaro burkire kona utakazo mukamagano akatakwetagisa abo burwiro bwo umutaraza kuturura kurwo mututu kugira iwereba ngo waye kuma na munongo ruko nabo mu ngaro urukwehara akamagano na wagira akamanyisoko na ukakwato musuiza ukanyangarara ukaterwa umutwe gafuka uzo mwirwaro bakucebere kandi utahiriro muno burwiro tubire twino bundi obwa mpox so mwe turiyo mukati abagako nimbasaba mwirinde ekinakigamba muhero mukitaka twara message zindi za cancer mwirinde burwiro obu obwa mpox ne Ebola kandi abagwire abino burwiro bwo kwasirimu baza kumana batunge mbazi nkabulizo tugambire n'abashobwa bahereze mbazi nezi nkeshatu twanze twayesotinga abakozi tukiriyo mu nchiko tukamanyire ekirarugemu
omunyangore ntayakira omunyangore nasheme omunyangore naza koraboryo omunyangore kucozanira abagenyi ekinyangore ayimana yobora kirenge kirere nta kigambe cyagazane nyangere iromwana yasoma muramuwe kirere.
Had 3 objectives, 3 or 4. 1, we want to advocate and improve cancer services, funding and management across the nation. Chairman LC1 has made his plea. Number 2, we want to increase public awareness. Elizoba twazagamba omukoro twenda gamba ali cancer. Ekyatuleta tokugamba oluzungu. Ekyatuleta n'okugamba ebintu ebitukuza kwetegereza tuli kumanyisa abantu obuzibu bwa kansa na nabwe nkitushomera kuba ntubulwanisa nk'abanya Uganda iraho tukani tugamba ngu ebyabagara n'ebyabashaho ekizibu kyona mukitwalira doctor eligenda nekitu twena nambwe ngenda kusiima imwe abanyamakuru mwebale kwija kandi manyanga bitukuza gambira nebiza kwikahare bika abantu bona babimanye. Ekyo kubanza kansa neki kintu nekitusasha itwenka bashaho nekitushasha munonga iyo kuhandika emibazi ohereza omurwira akapapura ngwe jina nyine yakwaho hati je ndoronde emibazi omire ekyo nenshabangu kirondera omubazi tukirondera omubazi kirugo mu bantu bitu kitwiye w'obuganya kitwiye wa okushasha omurwire nakurugo mu misho mwanya go kugira ngo Dr. webale kundagurira agenda ajizira to mutwe ngo hato bunaza ugo mbaze naza kugwiyankaye mutukiyewo twabashaba mukiyewo ekintu ekyo kyatukora kubi. RDC olia president witu mumugambiti ekyo kintu nekishasha abantu tabambarara bonka konkana handi aba doctors baruho nituba tuyine ebintu bitukwenda kukolera abantu bitu konke bikozeso bitukora kubi oshanga nonda kushemeza omurwire otine bishemezo lero mugira ngo genda mbarara genda murago genda agenda atashemerirwe agenda nakasinga kandi iwe waguma irwariro uri kumanya icyo gukora uguma mbusasi nga mukiyeho twabashaba atana na mushanju omuri yabo bishatatana na mushanju abakazi 295 babire bine kansa babire bino obubonero obukworeka ngu ne babasa kuba bine kansa w'omunwa gwa nyinenda. Ekyo nekimanyisa ki? Nekimanyisa ngu ati batandika olugendo olw'okuza kubakebera gye n'okuhamisiriza ngu buzimazima kansa bagine ninga tebagine. Twagaruka twareba abakazi 357 omuli abo abakazi 98 babina obubonero obukubasa kuba kwoleka ngu bine kansa w'amabeere. 357 omuli abo 98 bakubasa kuba bina obubonero obukwoleka ngu bine kansa y'amabeere. Tukubaleba twayinza kubaswizuma tutyo tubasindika aha Regional Referral Hospital kugarukamu kubaswizuma n'okubachebera n'okubiyawo obunyama leero bakakase ngu buzimazima bine kansa ninga tebagine. Omuli abo abakazi 108 twabiyawo kitukweta pap smear. Pap smear n'okuchebera kwa kansa w'omunwa gwa nyinenda. Byona ebyo twabikolera bwizi bwera. Twagumiza mutwaleba abashiija. Twachebera abashiija 305 tukubachebera kansa wa prostate. Omuli abo tuyamu abashiija 47 abino obubonero obukwoleka ngu bakubire bine kansa ya prostate. Omuli ebyo honorable twagumiza mutwachebera abantu tuli kubachebera sukali na pressure. Ombashiija 305 twashanga abashiija 91 bine pressure. Ekyo teyogumiza mukuya wakanyama nga nogipima omanya ng'ogine ninga otagine. Ababo 91 bane bakole emirimu yabo bakugenda bakuvuga amagari gabo bakuvuga emotoka zabo tebakachebezaga tebakumanya ngu bine pressure bakimanya omubiri ebi bishatu. Ekyo nekituteetera 30% prevalence. Ekyo nekintu kihango munonga nekimanyisa ngu abantu bitu bali kubi konka oba bakubi tebejumbira omu kuchebeza kandi tebakumanya. So bantu mwe ati n'abahindukira nyenda kubashaba n'okubaterera omuranga imwe mwize muchebeze mumanye kumuli mwamutachebize egipressure nekutera ekuraza stroke. Ochero muna kutakubasa kugamba, ochero mukashesho mukono kutakubasa n'okuhandika ezina lyawe, otakubasa na n'okunaba omu miisho abwa pressure. Aba bashiija 91 biija abatakumanya batakachebezaga twabagambira okubanza mumwine pressure kandi ete iguru munonga. So ntwenanga mugume mwizo amalwaliro gitu. Amalwaliro gitu gona health center 3 na 4 n'okugaruza iguru bine obubasa bine nebyoma ebikuchebera pressure ebikuchebera na kansa w'omunwa gwa nyinenda n'okuchebera n'okwegesa mwije muleke kugwa kubi. Twachebera abakazi 437 omuli abo twashanga abakazi 98 bine pressure babiri batakukimanya bakimanya okubanza for the first time. Ekyo nekimanyisa ngu babalyoko mu byalo byabo ebakutuula konka bine pressure. Obu bakimanya twabatandikisa emibazi bwana RDC kawo nabebembeza bali aha hata aba bantu bona bitwachebera kuruganirizo batwabagita kliniki yitu egichikweta non-communicable diseases clinic nibazaguma nibatutayirira buli kwezi tukubaleba tukubalagurira bakwenda emibazi. Ekintu ky'emibazi n'ekintu kihango ninangu nkigarukemu emirundi mingi obundi kikaza mu mbwongo bwitu tumanya ngu emibazi netugenda twakebera twagumizamu twakebera na sukaali omuli abo abantu 5 babashiija tuyiyamu abashiija 12 babiri ne bagenda konka batakumanya ngu biine sukaali bakimanya hati obu bakebeze twagaruka tuyemu abakazi 11 bakimanya hati ogumurundo gw'okubanza ngu biine sukaali obu wakimanya ngu oine sukaali nyabo nabwe noza kuguma mubazi gwa sukaali paka chairman LC1 yabuuza ngu bwo bulire ne bukira ego sebo chairman yastamanga chairman ne bukira ne buza kukira twakuchebera twakwata bukirikale kanse etaka jenzere hare sukari etaka otaka kuhumize otaka kubire sukari etaka kutemere bijere sukari etaka kubinjira mu kitanda iwe mushija we wategereza kuza kubanza kushasha sukari neza kushasha ekubingo mu kitanda ekubingo mu nkito ekuremese no kumanya ngu wakwata ekikwosya engalo zone ezikole kubi sukari neshisha
enda okutwala omugisha ogw'okubanza kwebaza Ministry of Health na Cancer Institute okusharamu kugira ngu omukoro ogu gube Mbarara District na nishaba abanyambarara tutere Ministry of Health na Cancer Institute murago ahagwo kwikiriza ngu omukoro ogu gube Mbarara. And I want to think that okwija kw'omukoro ogu Mbarara turukwija kusiga abanyambarara nico kimwe. 1 tutungire omugisha gwa motoka ya kanseji kumaraho ebire byemazireho ekakebera abantu. Kandi on that note, Murago Cancer Institute, I want to thank you. Inyenda kubebaza 2023 ekimotoka kya kanseji kikayijaha ahari Rubindi Health Center 3 in Kashwar North Constituent chamaraho wiki yona abantu bachebeza, and I want to believe that so many people were saved at that time. Last year 2024 ekimotoka ekikagaruka kijo muri Mbarara District home kyatayayira amarwaro gitu mushanju gona agutwine Health Center 3 mukaga na Health Center 4 eyabwizubwera buri Health Center yone itwine ekimotoka ekikagira izoba erikyasibiremu abo kuri umuntu rwo kubanza okyabanza kwija abantu bakagera ngo cyazahari kuguma Rubindi kyemeriro omwanya gumu. So next time kukizire twagira ngo kize Kagonji kirge Kagonji kize Kashare kirge Kashare kize Rubindi cyaruga Rubindi cyaza Bucuro cyaruga Bucuro kija Bwizubwera cyaruga Bwizubwera cyaza Rubaya cyahendera na Bubari. So every health center eyitwine ekashikwamu ekimotoka eki kandi nyenda kwebaza abantu na munonga abakyara abo kuba ekimotoka ekyo bukyekirimu nkabampuka haha marwaro konkani nyenda kwebaza abantu na munonga abakyara abo kwejumbira okukyebeza obwire obwo obw'ekimotoka kyabire kirimu tubarekiraho numureba n'omukoro ogu ogw'okwijuka nomanya emikoro endiijo nebe national celebrations egen commemoration just because tine kitucelebrating omuri kansa omu burwire bwa kansa konkani twijuka oburwire bwa kansa twijuka abo butwire twijuka abafiire twijuka ababurwire. That's why we don't call it a celebration day. Ninyenda kwebaza bwana DHO and your team, the district team. I have no words to say thank you. Mbarara district age we have had issues when it comes to health issues. Nyoweni chitamaka chikoke byamagara, but I have fought hard to ensure that people recognize Mbarara district away from Mbarara city. When you talk of Mbarara, even when we're in Parliament and you're on the committee and you talk of Mbarara with where you want it to be elevated to a community hospital, everyone is like, but you have a referral. Until I stand on my feet and I'm like, Mbarara district is different from Mbarara city. And I want you people who are here from Ministry of Health, from Cancer Institute, from wherever, get to know that Mbarara is an entity of its own. And that's why we are requesting for a community hospital. And I want to say this, abanyambare chikanchi bagambire na Dr. Kamara mugenzi wanje onkushitama na wa committee ya health on parliament. Ngu eryirwaro ryitu lyabwizibwera tulitiro mu budget ejeje yitu tukoreje. Kandi Dr. Sevitinde no memi anje niwe. Inkugambira nti nakitayo ekyalo bindi here center kakugamba nti nakitayo tutwija tutari omuntu bindekere supplementary budget kuyarabiremu rubindi bagituhereza hati turiyo ntombeka here center for. So ninyenda tukwatanisize hamwe munshabire, and I want to promise you this, unaba nchiryo mu parliament gwizibwera netekwa kuhinduka community hospital. Tindu kushama akachiko kebyamagara then abandi bakatwara wabo nkaguma nindebe ekyo tukiri kubasika rwo byango ekyo tukikuba bwa kansa kuza murago ekyo nchimanyi chimanyisa mutwaza kumana tukoma Mbarara and twena ntutekateka ngu ekyo nikija kubaho kwankani nyenda ngumbagambire obuna bentakajire mu parliament okana oshoti byanguhi, but I want to tell you this country is big. Ihangeri nerahango and the resources omweno shanga zitamara konka ekintu kyemibazi ya kansa ekichairman LC1 yatambaho nana echi DHO yabari hina kurura hampa hatkuya yejero nyankore nari hina kurura mu nyankore ninyenda ngumbagambire ngo kintu kyemibazi ya kansa tukugira ngo embazitero konka barwire nibakikira. I think nko kuna kubasa kukitantyo abarwire ba cancer ni bingi. Yesterday I was reading Monitor looking at how many people last year yonka tubetwine abarwire bari ku 25 ahirwaro murago ba cancer. You can imagine abarwire 25 ba cancer. Emibazi no yakubaningana nehwaho. The only thing I think Dr. Kamara is here, my colleague, ntuisha kugira ngu bonjere Cancer Institute budget kugira ngu tubine sente konke sente abarwire nibazikira abokuba. The first time I think Parliament gave cancer an autonomy kugira ngu yegurire emibazi ningira ngu twatandika na billion nkamushanju zija zizo 10 n'ezindi, but still esente ninche. Ninyenda kuchibagambira ngo esente za Cancer Institute ntubahereza obuhumbi burenjero muri 10 Cancer Institute eje yimukureba konka barwire bagumire nibakire sente. The only solution no kubonjere sente. And nintekateka ngo omu budget framework papers zanyu ezitubire ntwakira aha parliament the whole of this month of Jan kumukuba mtatira mu budget nitwaba parliament hino tukujishanga. So kanye sigengo butukiryo mu budget process, you will let parliament get to know of your intention to increase on the budget of Cancer Institute. Ninyenda kugambira abantu banje bambarara
odga muri Mbarara ninga notekateka kwijo muri Mbarara abaling suits beno buraro bwamani munonga kandi benene bitanda birungi tibakakoma buraro benene bala nungi bozirimecho kumye cyaburi muringo bene na hotelo halimu emere yachiraguju nangwa n'ekijungu kandi orende emere yo kutwaro waba baling suits nacho barachikora echo mujungu ari kweta ngo ni take away bene na sauna na steam ogesro na massage basa kubura bayikira kugira ngo akoboherezobwe parking yabo ne yamani munonga kandi n'impango ebyo kwerinda byabo biri guruguru munonga kandi aba links youths barashango mu rurembo rwambara omuri Katete waruga parking ya bodaboda ya St Mary's uri kwenda kubukinga urabasa kurabera namba ze smeji 0 kaga na mwenda kandi urabasa kugamba na director wa links youths uri kurabera namba ze smeji 0 kaga nemwe 555 ogesirone ya 0 kaga nemwe 555 twena katurukangira links youths kugira ngo tutungo ubuhereza burungi
aha kimotoka kya kansa hariya hahandikireho ekigambo mbu early detection saves life. Okukyebeza kare nikutangira amagara. Ninyenda mumbagambire ngu kansa enyingi zisire abakyara aha bwakanyije ndaguze. Nkashasho munda ntomu ntwire omugongo nigucweka ninzo mu nshonga tinkuzirugamu konko bwogambe ebyo byona ohinga osharura obanza kubyara noyenda kubanza wayombera okiza kuhika ha muheru bashanga kanse kakurya kare yakumaraho nabeshengereza ekigambo kiriya ekirya ha kimotoka kya kansa tibyanguhi ebyamurago tibyanguhi ebyambara tibyanguhi nyowe kansa njineho enkojo Dr. Sebutidogu nawasa kuba nakimanya. My brother who follows me, his wife got cancer within 6 months. She was in the grave. So cancer mutakajizana ebibyo kugira ngo ninja kuchebeza tubirugemu wawuro inaho kushasha gendo chebeze okwo mu kishoku mwahurira DHO yagamba tukuru mu district sezindi. And on that note, I want to thank the Korean friends for that chance that you gave to my district in Mbarara, whereby every health center 3 has the cadres who can work on cancer patients, especially when it comes to detection. So, Tiburi district yona ngwamarwaro gayo ababa Korea bajungwa mukurebaha ngo bakazayo bayamba ngo amarwaro gagira bashawona nebyome byo kucereza hatu nabasakushangana nabibanda nibija kagonje kuceberezayo konki wo wakagonje wo murimbara oyine chance to kuzayo ito twine chance nk'abanyambara kugira ngo abajungwa babakatunywana buri rwaro ryituryona batekamo echome kiri kuchebera kandi bagaruka batu training rabasha akakoko akakurwaza kansa ya munagwanye nenda aha mukazi nikizira habushija bwo mushija mwachura bakazi mwe mwachura iwo waba nozoko beno mango mushija yaza kuteka mudiga hari sirimu ine bijuma nitubimera ntubaturuho kansa kwe kukwata ne kutera go nabeshengereza abashija barya mucendezo kusiga kakoko imwe kamba gambi abashija barya munywera hizuba rumwe DHO yaja munywera hizuba rumwe erwa mariruho ahagwo kubaka kokako nimwe mukajanjaza.
I am Dr. Mutungi Israel. I head the clinical services at the Uganda Cancer Institute. I'm a senior consultant oncologist. And I am here representing the ED, Dr. Gerald. We recognize the devastating impact of cancer onto individuals, the families and communities worldwide. We also acknowledge the progress made in cancer research, treatment, and support. Today we gather here with the theme of United in Goals, and unique in our needs. With that theme, although every patient, every family, every community, and every country has unique challenges, but we all share the same goal of reducing cancer worldwide. I liked my sister. Of course, she was speaking in a language which I understand very well, which not many people are very comfortable of talking about, but I liked it so much. Thank you so much for that, for those words. But you know, getting saved is a process. So even people, the men which are get saved slowly and do not transmit that. Yes. Thank you very much. Today, we celebrate the dedication and perseverance of healthcare professionals, researchers and advocates working tirelessly to combat this disease, cancer. As the ED of Cancer Institute, I'm proud of our institute's contribution to cancer management and care being given to Ugandans and people from the neighboring countries. It is important to know that at the Cancer Institute, we get 20% of our patients are foreigners. We support research initiatives. We provide critical services and support to cancer patients and their families, and we do advocate for policies promoting cancer prevention, early detection, and treatment. We also promote regional integration of cancer services in Uganda. And so far as Dr. Nicholas knows this very well, we completed the Gulu Cancer Center, Regional Cancer Center, which is now fully functional. And as we speak now, they are seeing cancer patients. And currently, we are waiting approval of the fund to start the construction of a multi-purpose cancer center in Imbarara region. We are planning to have cancer centers in Imbale as well as in Arua. We do recognize that there is too much work to be done, but we have to intensify our efforts to reduce cancer risk factors, which Dr. Kamara, when I was a young person, I used to steal exams and I would look at my neighbor's papers, but I know you are going to talk about tobacco use and alcohol. I think I sneaked that, but I won't go into that. So we have to improve access to cancer screening, diagnosis and treatment, particularly in the low and middle income countries. We foster knowledge sharing among stakeholders and accelerate progress. As we move forward, let us draw inspiration from the countless individuals and the families affected by cancer. Let us unite in our pursuit of cancer-free future. Ladies and gentlemen, together we can reduce the burden of cancer globally and improve the quality of life for cancer patients and their survivors.
My name is Kwizera Christopher. I work with Ugandan Non-Communicable Disease Alliance as the team leader. Ekigombe ekyo nikirwanisa endwara ezitaraturira mu kwatire cancer, shukari, n'endwara z'emitima nka blood pressure, sickle cell n'ezindi nkezo. So ekigombe ekyo nikiri Kampala tukwatanisa na Ministry y'ebyamagara kurwanisa ezo ndwara. Ezo ndwara kuzichendeza ekikuru ekikukira kuzireta n'embeera y'abantu n'emitwalize y'abantu ebari kukora n'endya y'ibari kulya n'emirimo y'ibari kukora. Ekyokubanza ekikukira kuzireta n'okunywa amarwa mingi. Ekyakabiri no kukozesa etabe kugiresa ninga kugirya ninga byone biri kurugwa mutaba n'ekindi ebyokurya bituri kurya wali ebyokurya biri mushukari nyingi ninga ebyokurya bine bishaju bingi watabikendize de n'ekindi no kugira ngo abantu bakakora exercise ninga tabakakora abagande cyo kweta drill so ntukutera abantu ngo bagezeho kugira ngo bane bari ebyokurya bari emboga ziceze ciraguju then etabe bagireke bagirugireho kimwe then namarwa bagakendeze ninga n'ekindi bagareke so babase kuba n'amagarama cyonka kikukira munonga baze kwekebeza wagira akagisa waje mwirwariro bakukebere shukari bakukebere pressure bakukebere cancer orengo wamanya nkokoli endware je baje kwato bwire bukirikare nibabasa kujijanja bekoreki ekire cyonka wotagire kwekebeza obwire bukirikare baje kwata yakuzire neza kukwita kandi okolisane sente nyingi ogire no mwirwariro obwire buringo
bamukozireho kinkima
tushomisa abantu tukebira abantu kandi tubakubiriza ngo bagire bazerinde ku rugo mwaka gwe 2023 tutwiro muri Mbarara Shema na Bushenyi turi kucebera abantu turi no kubashomesa tukoise na UBC radio turabyaho talk shows turabyaho ebirango turi kuterera abantu baze kwekebeza ningashi bareke kunywa amarwa bareke no kukozesa setup so twikira abantu coverage ya UBC West radio na TV yona tujimazireyo turi kushomesa abantu then tubashomesa n'abashaka bo mu byaro shomesa n'abashaka ba amarwariro twabahane byo kucebeza abantu kugira ngo bagome bazahirwariro bekebeza twakebira abantu bari kurenga emitwari 10 twakira abantu twashomesa abantu bari kurenga miliyoni 5 kubashomesa so tumaisa ekikumaisanti abantu tubayikiro kandi tubatere tubagamira ngo baze kwekebeza
shillings in 3 years of project lifetime. We are supporting the strengthening healthcare system and building capacity and addressing health challenges together. So through this partnership, we have support training the healthcare workers and provided essential medical equipment and consumables, and expanded community-based screening services program. Because we believe that no one should be left behind when it comes to health. So we are very humbled to support Uganda in its effort to ensure that every individual, regardless of where they live and who they are, have access to life-saving cancer services. So to all my Ugandan friends, please take advantage of these free cancer screening services and available to you, and encourage your loved ones to do the same. And as Korea and Uganda continue this journey together, Kofi remains committed to supporting Uganda's effort in building strong and resilient healthcare system. So our goal is not just provide the temporary solutions, but to support sustainable change, so that the impact of this partnership continues for future generations. So again, I want to thank all the healthcare workers, professionals, and political leaders, and VHTs, and the people of Ankole, and for your dedication and expertise to this cause. So your work is invaluable, and you're the backbone of this fight. So, and your commitment gives us the hope for the healthier future in Uganda. Thank you.
Nicholas Kamara, the member of Parliament wa Kabale Municipality, kandi kukuba bagambira niye ndebe mbere akaciko akara bacicirira mu Parliament kara barwanirira umungwara zitatulira eziba bagambira kurunji eziba leta nani communicable diseases ziri musukari umutima indwara z'ebihaha hamwe na cancer iri turi kwijukerizo ebezaho kace na experience yanje nyo mushaho muto hakije ndwara ibaga baleta silimu indwara ibaga baleta silimu ubwo bwire ketine mubazi eketine mubazi umuntu yayijaga ayine kirukano isande rije ayija ayine cryptocurrency rwara umuraramu yakurataho agaruka yine pneumonia umuntu umwe atakabire no kufa agira ati no buno kwefera hati nabona bona muno twabere turi ngo mu mwaka gwa gashatu umubazi gwa sirimu ngo kubanza bagubona the first drug that was discovered was AZT konka tigwakoraje konka hina ba survive injira yo kumubazi bija barano twabona umubazi gwa kabiri nabwo abantu bagumira kija twabona gwa gashatu atakokatanika gukora ki kucendera konka abantu bakaba bataragubasa ecyagira kwindura ebintu bya sirimu byona no kujanja abarwire ba sirimu ne sente zi President Bush yahire Uganda isente ezo zikarebeka muza za janjaransi. The game changer in the fight of HIV in Uganda was when President Bush government of America gave us the PEPFAR funds. That is when we started emphasizing the community health care services and as far as HIV is concerned. That is when the free drugs were provided. That is when the sensitization increased. That is when the awareness increased. Another thing that was done at that time, I remember as a young medical student and actually as a young doctor, I was called for training. The training was how to prescribe ARVs. And I did it for 2 years. I was doing an online course, HIV education, for 2 years. I did it. They gave me a certificate to prescribe ARVs at that time as a specialist. Then I remember another time when I was called to SETA. I was also called to learn how to prescribe drugs against antimicrobial resistance TB. By that time I was a little bit hesitant that it was never going to work. As we talk now, as you know, even the VHTs can prescribe ARVs, which if we are well trained. And I will come to this much later. So our HIV experience has taught us, first of all, that public health care works. Primary health care works and public health works. That is one thing. The second thing that this experience has taught us is that we need money. Kagaruke mutse butinde kakagaruke mu rukiga nange mu rujungu konka ekisirimu yatwegesize twamara kutunga sente tukamanya ngu obujanjabi wabuleta hansi abantu barayenjerwa kuganyirwamo. Ekyakabiri kitwamenyere twamanya ngu turetaga ekintu kyoleta ki esente. Mwarabulira mwamuntu ari kugamba TV ati twagala kutunyonyora twagala kintu kimu kyokka kiki sente. Nitwe naki abarareberera barwanirira omuntu abararwanirira indwara za sukari za pressure, nitwe turenda mu government etuheki abo kuba sente zaziriho obijera mpa government ya USA biracyate sente nyinjo mu HIV. World AIDS Day sente mushaho umuntu kwara kunde se World AIDS Day ministry yona kurirya yaba NCD baraze bagire World AIDS Day konka esente yetariho tukapira World Diabetes Day 10 iketine guest of honor minister tukamweta yabura permanent secretary yabura bamutunji bayebuzaho zaba guest of honor. Yes, twagira ndijo kabare recently kuza kubona minister wa health nangwa ikeho. It was a tag of war. Akatari. Agenchi hakatari henchi. Turenda chi? Then there is a World Cancer Day, even the UCI director is not there. Yes. You see, we are orphans, and I want to say this very painfully. It covers one non-communicable diseases to be a fools. Yes, and if you want to, you can go and tell Honorable Jena Cheng or Diana or even Orem, I'm telling you, we are orphans. Even today now, but you go for World AIDS Day, even the president will be there. Same day. Yes. These government people must take this thing serious. So, lekanga luka na keja muramwa. Mutajira munagamba munonga na rajangwa administrative. But you know what happens on these other days. For us, we are just taken as a by the way. Muramanya barunji mwe. Izgo ba MPs, turabatura za hafu, turabatura za majenyi, turaza kubatiza, turazo mu makanisa, turazo mu makereziya n'amaramizo gona. Yekwe. Abantu obuturazika. Umuzi emyeze shatehuye tikahurira umuntu wafire malaria mwamurire mwene. Mujaraganye mweti barazika. Mwahurira umuntu owisirwa mushira. Baritwa gachi. Kansa, sukari, ensigo, puresha y'abatera, turiyo bitwa. Konka government esente tekatire mu kasente. Rwanda n'amarware rugambara naja ngo munyambarara ntamona kaliya buko banyamakora mbararo bwire bulimo. Iki abagambira n'amazima budget y'irwariro ryanyu iryabwizwe kugira ngo bagihindure district hospital twajitiremo mu budget ya Uganda eyo mwako. Nangwa na budget yo kugira ngo mbarara bagikore National Referral Hospital nayo twajitireyo. Hasigara turikuzo mu Karuru imwe mwayemereraga kujya babasha bakaruru mu mugambe mwoki murenda ki irwariro hano yamwe naka nambara iryo boji twashimazira magure twebari kandi nkahenwa ki kugira ngo umukazi mu mugarureyo hakire ncuro ya kabiri abo ko babinire plan ya mani abinire plan ya mani namwe nyo nanye mu ncuro yo kubanza kungana reba ariho natandika kumanyira doshinga hati wanye hetora ferwa ndane na ncuro ya kana mbone gukora je nyine mani kunge yo kubanza oro cyamanyira na za covid zikataha mu twakora je nakasente twakabona je ngira hati naba naste okugere wanye hayo abo ko no kuzafutayo no uwamutaye ncuro yemwe na hetera muma hati na leta agibiri nigishatu aho no kutandika gukora nero ayo MP wanyu abari ncuro yo kubanza ntabashaba muhakiri mwana hiye kace mubaho ncuro ibiri yo barakora ki o madere mukamunga nero magure cyecho so mureka tugaruka experience ya sirimu ine kubagambira
odga murimbarra ningano tekateka kwijo murimbarra abaling suits beno buraro bwamani munonga kandi benene bitanda birungi tibakakoma buraro benene bala nungi bozirimecho kumye cyaburi muringo benene hotelo halimu emere yachiraguju nangwa n'ekijungu kandi orende emere yo kutwaro waba baling suits nacho barachikora echo mujungu ari kweta ngo niteka we bene na sauna na steam ogesolo na massage basa kubura bayicira kugira ngo akoboherezobwe parking yabo ne yamani munonga kandi nimpango ebyo kwerinda byabo biri guruguru munonga kandi abaling suits barashango mu rurembo rwambara omuri Katete waruga parking ya boda boda ya St Mary's ori kwenda ku booking orabasa kurabera namba ze smage 0 kaga na mwenda kandi orabasa kugamba na director wa link suits ori kurabera namba ze smage 0 kaga nemwe 5 5 95 ogesero ne ya 0 mushanju mushanju 2 twena katirukangira links youths kugira ngo tutungo obuhereza burungi.
Let me inform you that we shall not get money like that goes to TB. We shall not get money that goes to HIV. By the way, Ebola, let me give you an example. We have now Ebola in Uganda. I can assure you, but by now there must be funds already got from donors for Ebola. Why? Because it is political. Somebody with Ebola in Uganda today could spread it from Uganda to America tomorrow. That is the only thing we fear. Somebody with MDR TB could travel to Korea tomorrow and take their MDR TB. Somebody with malaria can take it to Germany the next day. So, malaria would rather be controlled here, Ebola would rather be controlled here, TB would rather be controlled here, instead of being transmitted to those countries. That's why they pour a lot of money. But can you transmit diabetes when you travel to America tomorrow? Can you transmit cancer of the cervix if you travel to Germany tomorrow? Can you transmit hypertension if you went to Korea the next day? No. So, why should they worry about your diabetes? The second thing, we shall never get the money for NCDs like we get in infectious diseases, is that, do you know a budget? You know a budget. You know a recurrent and non-recurrent budget. A recurrent budget is a budget, and those also is starting to understand these things. A recurrent budget is the one which comes up all the time, like salaries and other things. A non-recurrent budget, which usually like to fund, even in the government. How come the other that one is easy. You give them money, they put up a building, but the next year, or a manyamwezo citizen group. So now a room now donors all talk a sending. Now whatever in the budget, they are talking about things like eradication, elimination, and so on and so forth. That one is easy because you can have, but to carry a burden, somebody gets diabetes today, and you carry a burden for the next 40 years. That is something the donors don't want to hear. So, we shall not get the funding like we are getting. Of course, we shall get funders who are very good, like our Korean friends, and I want to thank you for your generosity. But it will not be too much. Probably they will fund 2 districts, and that is it, maybe even 5. So, what is my suggestion? My suggestion is 1. Kwanza kuone sente barunjimwe ezo kutuma ndwara turaza gukora ibintu bishatu. Ecyo kubanza hariho ebibi bitano ebi murakoraga ebiturenda ngo tubireho konka mubiremire. Ecyo kubanza cyo murakora twenda mu kirugo mu gaturemeraho namarwa. Ecya kabiri ekimurakora tukenda mu kiruga okanga mukakiremeraho no kusiga no kurya bishaju. Ecya gashatu ekituraje mu murugeho konka mukarema no kuresa. Ecya kana ekituraje mu murugeho mukarema n'ebyambi muri nanye. Ecya gatano DHO yakigambaho no kunywa mizi kumijera mingi. Ecya mukaga imijera murajimanya ninga neshigambo cyo kuchika no rukiga rwenyine. So imijera ecya gatano no kugira ngo omweti muraza kwejemesa indwara iziturabasa. So twaza gukora n'iki kigabambe wa parliament. Ecyo kubanza waza kureba ibi bitane binabagambira ninga mukaga. Ibi bicumuro tubiteho mushoro. Ladies and gentlemen, I'm talking about the sin taxes. And the 5 sins are fats, tobacco, alcohol, and poor nutrition. And we are going to punish these sins by increasing taxes on the sins, which is otherwise called sin tax. Now I go back to my language. Ibi bitane ebi ishitwara kubanza gukora. Waza kugira ngo ecupa ya bia ninga waraji waza kujinywa tubanza tuteho umushoro mwinji munongane waza kujinywa kushasha. Echo mwashikunda? Aha. Echaka besiturateho umushoro ni soda. Namwe mwebo orashobora naramura nyeshitiri bitatu mwana soda munongo. Konka bo mutaho no kubari kubi. Aho mutaho ni kuri barengaye bari kubi. Barunjemwe. Twine hagara byinje mu tawuni umwana ari mu kakare kare atembe boda. Aza yishemero. Bamushomese kurugo mukasheshe kwiko mwebazo tine ki yakozere ndangwa nakaseze ko yakozere. Bamuhembere ki? Bamuhembere soda, bamuhembere keki, bamuhembere chapati, bamuhembere biskuiti. Nibyo inenga nangwe n'umutabano wanje kamuhishi cyori yakigaruza mwana. Ntabwo ndabwije cyori wakigaruza ati no wahembere cyori umubantu bona yishomera. Ndibabine cyati babine soda, ati bine biskuiti, ati bine migati, ati mwenye natina kuchiri. Muramanya ngo nebishaha byitu. Amashomero ko barombeka hati tinishomero ryine kishaha. Nagabwinaho. Umwana waza bamutwara boda boda yayi customer TV ashange soda mu fridge ajinywe. Soda emwe erimo bujiko 12 bwa sukari Coca-Cola. Ubujiko munga? Ubujiko munga? Soda emwe ka soda ko kache kalimo bujiko 12 bwa sukari. Fanta erimo bujiko mwenda. Ngeno wokunyoka soda 2 urabanye bujiko 2 nabona bwachi bwa sukari.
Irware ryite ryambara Regional Referral Hospital rekatunga 2 CT scans yatunga ekyoma ky'okusingayo ekibara kweta MRI kandi ryine laboratory erikukyebera ebya cancer. Timunkwatsaho natukabasiima. Nimwebare bantu mwe ndikwenda kuturaho tindikureba honorable w'ebyambu Soraki nyine honorable and my close friend ogusharingire nawe bingi honorable Nicholas Kamara ijo mukande baba kureba TV turiyo parliament tsimbira amaju nimwebare kunkwatsa abo kuba nkani intaka nkomwebembezi wirware ryambara Regional Referral Hospital ntubara hangusye tuzamutindo gwa National Referral nicyo cyakutwera kasente gakirirayo rero bhereza bukagenda ryo mesha kunashyireyo nyowe ryo mugenyi nkashanga Dr. Kamara na mugenzi we Honorable Margaret Rwebyambu bakamobilizing bareta Honorable Kabasharira bareta Honorable Naruga Rukungiri twakwatanisa maraka bweni mbasima kandi rizabayemera honi.
It is a great honor for me to join you today as we commemorate World Cancer Day here in Bwiswera Mbarara. This day is not only an opportunity to raise awareness about cancer, but also to unite in our common goal of tackling this global health challenge. The theme for this year is we united in goals, unique in our needs. Speaks volume about the importance of collective action while acknowledging the unique needs and challenges faced by each community in the fight against cancer. I'm truly inspired by the efforts of the Ministry of Health, Uganda Cancer Institute, and our partners in non-communicable diseases, who have worked tirelessly in raising awareness and providing vital screening services across the region. As we gather here today, we reflect on the crucial role health screenings that have taken place since the 1st of January, culminating to this commemoration of this day. These screenings are more than just a diagnostic tool. They present a lifeline for early detection, timely treatment, and ultimately saving lives. Today, We gather not only to raise awareness about cancer, but also acknowledge the urgency of addressing this growing challenge. For example, in Mbarara, in 2024, we registered 1,400 cases of cancer. 742 were men and 658 were women. Prostate cancer and stomach cancer are the leading types affecting men, while cervical and breast cancer remain the most prevalent among women. These numbers are a stark reminder of the pressing need to do more in the fight against cancer. However, while the numbers may be daunting, they also signify the importance of our collective efforts. We are committed to improving cancer care and expanding our capacity to prevent and treat cancer in the region. A significant step in this commitment is the ongoing establishment of Mbarara Regional Cancer Center. You've heard, we already have the land fenced. We are going to build a regional cancer center. The money is about to come, we are about to start. You make sure this money comes, we start building our center, so that we will not need to go to Murago. But to let you know that it has already started. We have a regional cancer center in Mbarara. It has already started, though not to the extent that we want. So please use those services, go for a checkup. This center will be a game changer in the region, providing comprehensive care, support, and treatment closer to home for many individuals who have been traveling long distances for care. This is just one of the ways we are ensuring that cancer care is accessible and that we address the unique needs of our communities. But let us not forget that the fight against cancer extends beyond health care. It requires that we all come together as government, as individuals, as communities, to address the risk factors I've mentioned. We need to promote early detection, because once cancer is detected early, it is curable. Twizuka izoberi ahababa bwire ba cancer ninga habwa cancer munsi yona. Omwabo mwene babuza mu cancer nenchi. Ekikuleta cancer niki? Nyenda kugamba hari ebyo ahabwokuba ninyenda okukura endwara ezo mu ihanga ntakagambire speech ya permanent secretary yero banyeta Dr.Gerald Mutungi kandi nyenkura endwara ezi ezitakutulizana omu ihanga. Twine division ebakweta nga lifestyle diseases NCD department of Ministry of Health aza nyenkugikura. Mbwene oburwire bwa cancer ni manyangu abakugu babiri babagambire konka no manyo mubiri guri nka factory haba mu factory ntaba mu factory damage tuko tumukahura gango kitetea kibireki ni factory damage mwena yo omubiromu obutafaro bukombeka omubiri bw'abantu bukorwa omwene bugeraki no bucyankaranya butandika gukora obutafari obutari nomo obutari bwitu bwa burizo mwanyetegereza so ntabasa kucyankaranya obutafari bwo bucyankaranya butandike gukora obutafari obutari bwa burizo obutafari bwo buririre obutafari bwa burizo butandike kujanjara buze n'ahandi honda bunywe burye ebyo kurya byakurya n'ibiriho obutafari bwa burizo mpaka kanseti zireki ekutwire mwene ukoko mbukwate ngo kugira ki nka factory damage konka wine factory haba mu factory damages nyingi no yebuza haba huki utandika maybe za machine tizine oil nungi utandika maybe abakozi twashomisibwe je nkebyo mwene oburwiro okubwa yongire twayicuminteriza nenshi ekitwakubasa kukora kucendezo oburwiro mwanyetegereza mwene byo bantu babagambire ebi obunafu obutakora exercise n'omuntu kureta ki obwire bwa kansa bwayeyongera tukwanya ngo abantu bakare bakabatambura bazambara bagaruka mwene ati mu kitambura na no kuza district n'umwenda board namwe n'abakuza ku rugamba akakuza mu center n'umwenda board ubu nafutu twakitambura kwikizangwe cyagama yitegereki ezo micweko kuyona yone ihe yo brofa hatosanga ngo factory damage yagira ki yayiyongera mbwenu nimba haga mugereki mukore exercise mutambure oba muhinge yo mutwara kwimera ifiti ujyo tuwamponisa kanso kureka gende yutambure ukore exercise kugira ngo ishaka batugikize tambure ihe yo brofobu amagagi tukagendeke abo bwire ninda kwashomesa kokanye ndakurafusi ecyakabiri n'endyambi namwe narebo kwenyo bari masika za chapati ebukomando ebyo bashoye kwito bakaba birya bakaba tagiye shwiga bakarya dodo bakarya bitoke bitekere n'imboga zitekere kokate mbiri tuyo tugita mu cyafu ebinte bisikirwe oyiro nosanga amahanda bari basika chapati omushenyi nuguzamu emusake kuraba amahaza mu mushenyi mwene omushenyi gwa yetagoro mbuto watamu engano yo warya ngo bya chapati ngiyo byo mugiga ebyo bakaba birya endyambi akakitagara kahabyo kujya bitu bya burizo tumukubirebe ibijume byo twe twabire turya reba tere cyane kirujya harimo karotsi harimo kabeji harimo dodo harimo ki umunyu reba gutekaho tubyo munyu mwinji namwe n'abacondiza bagize kunu yatwinde kansa nyengi yorra yachange kansa yachange batango buno munyu mwinji kutukulya abanyankore omunyo mwinji ogwa barire tukuteko mbihimba tukuteko mushabwe natwana tujya twongera mu munyu ibyo nabyo biretara ki obuzu none ukuntu tucendeza hamunyo kutukulya tukacendeza ha mashaju rero twika ahakunywe binte biri musukari turengesereza nobo ya TV ohurra rero nosote nibikorwa muri mbara kumbucha mu bigambe byone nibikora TV obikora embogo chituzi kama nayamba ebyo byona mbabiri musukari tibyo kujya birungi mukuru w'ecyanga urabyo kwa kubigamba aho kugira ngo tumukore exercise numujya kubi amani gachitanda gachirema ngobye kumbucha ngobye mukama nayamba nga kore exercise irya kurungi amani gachitanda ngaza kwisha baparege kubiha ngo mukama nayamba ni yagira ki amarwa we bari wagamba amarwa ahandi nitushemba mbikopo byo mpira ntushemba ombya volleyball ntushemba ko kufika hamarwa tusinga namwe ni Uganda nasote niyo namba 1 mu kunyamarwa tukora twahona Nigeria mwe na choto chendeza hamarwa kan weko ba kamuanda lengwa you are fearing the